Hello everyone, dear friends. A common pain, knee pain. Our patient has a pain in her knee. Doctors insist on surgery, injecting something and draining something else. Now I will explain why surgeries should not be done, why the knee hurts, and what causes knee pain. I will explain about pain in the knee joint. The main cause of pain in the knee joint, which is often experienced by many individuals, is a common issue. Above the knee, such as inside, and for example beneath the knee. Responsibly the first muscle, the front surface of the thigh, rectus femoris. Here it is. Well, I drew it like this. It is attached to the tendon. The tendon of the rectus femoris runs above the knee and attaches to the tuberosity below the knee. There is a protrusion here that can be felt right here. Here, the tendon of the front surface of the thigh is attached. Then, the vastus medialis and vastus lateralis muscles are also attached, respectively. Three muscles that are responsible for knee pain. The rectus femoris is on the front surface of the thigh. Then the vastus medialis is right here, also referred to as the patellar ridge, right here. And the vastus medialis on this side, right here, you see it already hurts. Trigger points that cause referred pain in the knee, such as in the knee itself and other areas of the body. The first, most active muscle, which causes the most pain in the area of the knee. The knee itself, the knee joint, cannot hurt. There is nothing to hurt, just like all the other joints. First, the trigger point. I'm drawing it here. Can you see it? I don't know. I can see. I can't see. Now I'm pressing. It hurts. It hurts. It hurts. Yes, it hurts. The second thing regarding activity. This accounts for about 40% to 60% of the pain. Here is the first trigger point. It is located here. The second one, the most active, here. Here somewhere will be a trigger point. We press, it hurts. And the third trigger point is active. This is right here, the so-called patellar ridge. Everything. Calm down. Once again, the anterior surface of the thigh. The rectus femoris of the anterior surface of the thigh. The most active one takes on the most load, and the trigger point is right here. That is, the knee will hurt, and the trigger point will be right here. The second trigger point is right here. You can palpate here, and there will be a hardening. The third trigger point is right here. Tendon. The rectus femoris muscle attaches to the tendon, and the tendon goes over the patellar ridge, which is located covering the knee. The knee covers and goes above it, and it attaches here at the tuberosity behind the knee. The treatment process is a crucial step in ensuring the best possible outcome for the patient. It will begin at this point, then continue at this point, and finally at this point. That is, when the rectus femoris shortens and is in a hypertonic state, trigger points form in it, which are the main source of pain in the body. The trigger point is located here, the knee is located here, but from this trigger point there is referred pain to the area of the knee. Then this muscle shortens, pulling on the tendon to which it is attached. And the tendon attaches right here, below the knee. The tendon, like a string, is also extended and in a manner exerts an effect on the knee joint. This muscle also shortens and becomes rigid and inflexible in the body. It exerts pressure on the knee joint, and this muscle, the tendon, here also transitions into a tendon, which also exerts pressure on the knee joint. The knee joint is trapped in muscular tendon compression in the human body. The following occurs. This is a common occurrence in many individuals. It stops being hydrated, and the material for the production of synovial fluid stops coming here. Waste products are not eliminated because everything is slightly constricted here. It begins to dry out, becoming desiccated. Metabolites are not eliminated. An acidic poisoned environment forms. The ligaments, hyaline cartilage, and joint capsules start to dry out and deteriorate. Because what is a joint? A joint is a movable connection between two bones. That's all. The joint is held together by ligaments. There is hyaline cartilage that produces lubrication. There is a joint capsule that naturally contains synovial fluid. Everything is lubricated, and everything is elastic, so that everything remains elastic. The muscles, particularly the front surfaces of the thighs, should not be stiff. They should not be hard as stone. When they are stiff and stone-like, when they are shortened, the nutrition of the joint is reduced to a minimum, and the function of the lymphatic fluid also decreases, preventing the removal of waste products from the cells of the joint itself. It starts to dry out, the muscles shorten, the tendons stretch, and there is a feeling of stiffness and pressure. And we start the treatment. In this case, the trigger point is here. The muscle needs to be treated, hypertonicity should be reduced, and if there is fibrosis, it should be eliminated. The patellar ridge, which is an important anatomical feature, is located on the anterior region of the front surface of the human body, specifically the thigh. Dear friends, before going for surgery, consult a specialist who deals with the treatment and diagnosis of muscle conditions. Because the knee joint cannot hurt, just like the elbow joint and the hip joint. Joints do not hurt. The nearby muscles to the joint are painful, or more precisely, they cause pain. Once again, I will just repeat. Trigger point 1, trigger point by effect. 2, trigger point by effect. 3. No surgery will definitely help. Treat your muscles properly, and you will save your joints effectively. Stay healthy, dear friends.